Floods are the most common type of natural disaster and are able to cause many types of physical injuries and are able to lead to illness. Because they are so common and can cause such a variety of negative conditions, EMT should be prepared to deal with them. The following slideshow will further develop both the dangers and how EMT deal with them. Among natural disasters, floods are by far the most common, as 43% of all natural disasters are floods. For such reasons, an EMT is highly likely to come in contact with one when responding to an emergency. As such, EMT should be aware of the dangers floods may bring, both to themselves and their patients. Only then an EMT can begin to ensure their own safety as well as the patient's. Drowning, beyond injuries and disease, is the main danger in floods, being responsible for 75% of the deaths, and is often life-threatening. The main worries EMT should have about drowning patient is hypoxia and hypothermia. If the patient has hypoxia, the EMT should start ventilation early. On the other hand, if the patient has hypothermia, they should be covered with a blanket and kept warm. When treating a patient of drowning, an EMT's priority may change depending on the answer to the following question. Is the patient responsive or unresponsive? In the AVPO scale, there are 4 levels of responsiveness, the last one being complete unresponsiveness. The first is awake. The patient is awake and well, and responds as you would expect. The second is verbal. The patient only responds to verbal stimuli and other types of sounds. The third is painful, or pain. The patient only responds to pain or other painful sensations. And the fourth is complete unresponsiveness. If the patient is responsive, the EMT's main priority should be to keep them warm. Following that, it is important that the patient has a continuous high flow of oxygen. It is also important for the EMT to consider and look for other traumas, as well as monitor the patient for changes in their conditions. Last, check the patient's airways and ensure that the ambulance is warm. A patient being unresponsive is the most likely scenario when dealing with drowning. When dealing with this scenario, the most important thing an EMT needs to know is if the patient has a pulse. If they do, an EMT should open and clean the patient's airway. Following that, an EMT should place an adjunct in the patient's airway and immediately start ventilation with oxygen. The conditions of the patient should be monitored and the ambulance kept warm. In the scenario the patient has no pulse, most of the same steps will be taken, simply with more of an emphasis in things like AED, ventilation, and keeping the patient warm. An important consideration is a diving reflex, a physiological reaction caused by being submerged in water. It reduces the metabolism and circulation, which preserves a patient's vital organs. The diving reflex can lead to ROSC, return of spontaneous circulation, which may lead to the patient's life being saved without permanent damage. If the patient is not so lucky, they will likely receive brain damage and other permanent disabilities. During a flood, the average person's main objective should be to try and stay out of the water and find somewhere high above the floods, be it your house or a hill. Floods and other similar water hazards can prove themselves to be extremely dangerous, posing a threat to civilians and a challenge to the EMT. Thankfully, there are many methods for both EMT and civilians to mitigate the damage caused by such dangers. Every year, new methods and technologies are being born, ensuring that less and less individuals end up being killed and permanently injured by the very thing that gives them life.